Hello, I am Dr. Lorance Peter, Consultant and Chief of Gastroenterology and Director of Medical Gastroenterology at Sakra World Hospital. The treatment of majority of this bleeding is an endoscopic procedure. It is usually done with under sedation or anesthesia because patients are quite sick, and the endoscope is passed from the upper mouth or from the lower rectum to find out what is the reason for the bleed based on where the suspected cause of the bleeding is. And then we have various methodologies and modalities to prevent bleeding or treat the cause through endoscopy. There can be banding, sclerotherapy, laser coagulation, or sometimes even injection therapy, and there are clips, multiple types of clips which we can use for the bleeding, and we can stop it. So these upper GI bleeds, early hospitalization, prompt resuscitation, identifying the cause at the right time and stopping the further bleed is very important. So endoscopy, colonoscopy are the routine methods used. Sometimes we do not find any reason in these patients about endoscopy and colonoscopy. That is when we call it obscure cause. Usually it means that the bleeding is from the small intestine. So how do we look at the small intestine? We can look at it using CT scan or even an endoscopy like balloon endoscopy and capsule endoscopy. And if the bleeding is very brisk and endoscopy is not possible, even we can think about doing a CT scan, angiography, and that is where the interventional radiologist comes in with a interventional radiology procedure like an embolization to prevent bleeding and block the vessels which is bleeding. So early detection, if there's black stools or bleeding, you should bring the patient to the hospital. And even if you feel giddy or unexplained giddiness, and when you get up you are feeling unstable, there all could be a feature of bleeding. Recognition of these symptoms, getting them to the emergency as early as possible, prompt and early institution of treatment, and then adequate and proper endoscopic treatment are the best ways to go forward. Thank you very much.